Okay. Hello and welcome to today's live. Obviously, it's not Monday, it is Thursday, but we are doing it today because we want to introduce to you two additions actually to the HD Advocate team, Dr. Vic Patel and Alex Smith. So welcome, Vic and Alex.
Thank you so much.
Pleasure to be here.
So today what we wanted to do, because this is our first therapist addition to the HD Advocate. So we're a team of ADHD coaches previously, but we have now got an honorary therapist, dialectical behavioral therapist, Vic. And today we just wanted to introduce Vic and I guess get Vic to introduce what DBT is. And Alex has actually received DBT himself and he's an ADHD coach. So we thought it'd be really useful to have that perspective as well. So over to you, Vic. Just let us know what is DBT?
So DBT, look, is not just a nice guideline intervention, that is recognized nationally. It's, in my opinion, it's a lifestyle therapy. Yeah, that classic martial line of hands, one life, one opportunity to live our best life. And the reason why DBT is quite different from other maybe mainstream therapies is that we target the neuroscience of things, the neurology. Yeah, the whole statement's being good at feeling, not to feel better, So when you start feeling the 10 emotions, one will feel good because you're not always constantly escaping or masking or doing all the behaviors one learned just to ways to cope with, those neurotypical, non-neurotypical brain, So DBT is a skill set model to give you a choice to bridge between a stimulus and a response. It's split into 4 modules. So there is mindfulness classically. So it's not the way that we may have taught it. It's got a really good component called wise mind, trusting your own intuition, but also based on your value system. It's really kind of thinking critically, thinking more holistically too. Then we've got distress tolerance. So they're not just coping skills. So distress tolerance, in my opinion, are ways to hack that nervous system. Again, neuro pathways, especially when one's overwhelmed or heightened levels of emotion, or just the mind is just becoming overwhelmed in overdrive, or even just detached. It's ways to just hack that, neurologically speaking, to also create social safety in the body, which links to the next module called interpersonal skills. So how to relate with people, pro-social signaling. So there's a skill set onto effectively create a interpersonal connection to reduce loneliness and increase connection. As an example, especially with our over control brains, it will be really useful. And there's obviously a big evidence link for ASD and ADHD, and DBT really helps link that kind of gap. And then we've got the last module, emotion regulation. So it's really helping to realize, to psychoeducate yourself on the functions of an emotion. That there are 10 in DBT. We just say they're 10. And we want to name it to regulate it. A lot of research has shown that as well. Name it, tame that quicker, But DBT got the good thing. So, there's no point doing the DBT if we don't know what we're doing it for. So we need some meaning, some intention, some purpose, and the skill set will help navigate quite skillfully.
Yeah, and it's interesting and thank you for that. As you're talking through all of those different modules, just kind of in terms of ADHD specific, it's just so on point. Like what you talked about just at the last thing there in terms of relevance. For ADHDs, if there's no point, there's no point. So it's really important that they understand, that they're learning something for a particular point that's relevant to them in order for that to be successful. Like that's just one thing. But particularly, I think you said with the mindfulness as well, aligning with values, again, ADHD is, if values aren't aligned, usually, particularly in the workplace, what we see, it ain't going to work. So it's so ADHD specific, really, from what you're saying, it sounds like. It's so good.
Out there, the research is out there that helps, ASD and non-neurotypical brains, ADHD as an example, and it really targets it because it blends well because of the neuropsychology. So obviously, as we know, ADHD or ASD or any non-neurotypical brain is very much around neuroscience, neurology, genetics, yeah, just the way the brain works, but also fundamentally based. So the DBT has a neuro lens to it, which really just grips it nicely. So and I love it because the lingo is very much like there's always a skill for a problem, you know. So really amazing just to kind of create that neuro pathways and to create new neuro pathways. So that whole classic saying is you only know. What you don't know is what you don't know. So what we in DBT say is move towards things you don't want to do, which is discomfort, to create an agency within yourself.
Again, very similar ADHD coaching. What we do, very much encouraging ADHDers to lean into that discomfort zone. That's the only way they're going to kind of grow, which, as you know, with the rejection sensitive dysphoria, you know, they don't like to do that. ADHDers like to stay in that comfort zone because otherwise they could fail. So no, they're not going there. It's beautiful. It sounds, I'm very excited that we've got this edition. It's going to be fantastic. But Alex, I'd love to invite you to kind of talk about your experience as an ADHD coach, having received DBT.
So I found, prior to receiving, I've got personally as part of my executive coach training, I've got quite a lot of training in CBT and NLP. But my experience of CBT as it turned out, I was diagnosed with ADHD in my late 30s. It was a little bit unsatisfactory for me because I don't tend to make decisions rationally. I tend to, particularly when I'm in a good space or when I'm trusting myself, I make, when I used to do things like insights profiles, I was an extreme yellow, an extrovert feeler. So I make decisions by intuition, and I trust my intuition implicitly. And so in terms of that challenging, the idea of challenging, challenging thoughts and thinking about them very rashly didn't really sit with me. The way I came to DBT, and it was very, very useful for me, was I spent a lot of time living and working out in India over a period of 8 years. So I'm kind of very open. I love India. I love the energy, and I'm very interested. I lived and worked and spent 3 months a year for about 8-9 years in Delhi, and so very much kind of yoga, mindfulness, and kind of like Eastern or kind of Vedic traditions of like meditation and spirituality, and also astrology. I became very interested in that, and I actually sought DBT quite recently for something very, very specific, which was I've got a pathological fear of needles, and I've got a very good understanding of where it comes from as well, which is basically, like quite a lot of people with ADHD and autism, I had a very traumatic birth, and for the first 2 or 3 months of my life was basically in an incubator where my only kind of interaction was basically with blood being taken. So the traditional approach on the NHS to treating needle phobia is a very rational. It's either exposure, it's sometimes CBT, sometimes exposure therapy, but it really didn't work for me because it's not a fear of needles. It's not a fear of blood. It's not a fear of pain. It's not something that can be rationally explained. It is basically, I think the way it's explained to me by the DBT therapist, and I've worked with clients with PTSD since, it was almost like a PTSD response. It was very much that inability to control a situation, which at the time was, very, very, would have been very, very frightening for me and those around me. So I think it's what Vic said. It was very much the ability to actually sit with the discomfort and kind of work through it rather than trying to rationally challenge it. Although kind of like it sounds kind of almost the same thing, it's subtly very, very different. It was much more empowering than trying to challenge rationally something which had obviously developed in me prior to being able to make rational. I think there's a lot that you don't think rationally when you're kind of 6 months old, 12 months old. That comes when you're two and like, beyond that. So it also very helps with my kind of like, the intuition and emotional regulation aspects of ADHD as well.
Yeah. Do you find that as well, Vic? I mean, you'd have people that come to you having done CBT. And I guess, ADHD informed CBT. There's definitely a place for CBT for neurodiverse. How do you find DBT fits in that context?
Yeah, it fits that context because it really isn't about changing your thinking in the DBT terms. It's actually allowing yourself to create flexibility, neuroplasticity. Yeah, it's about that classic respond, not react. Yeah. it's really much based on that value work first, and meaning and importance, and being okay with thinking. So creating that agency to create that tolerance, create that gap, and reappraise your appraisals of things in your life, you know, because we only know what we know, what we don't know. So it's about having that openness. You know what I mean? And what really is good of why it helps with ADHD is because it really gives people choices across 4 modules. Because it's not just, well, I'm going to use this. It's not about using a skill. It's you are the skill. You know what I mean? So the whole idea, what Marshall Linehan says, is that the answers are within you. You don't need to look elsewhere. It's about
coaching.
Authenticity.
Yeah.
You know, and sometimes that might mean we got to let that authenticity land, allowing it to come through, to give yourself a question, not an answer. That answer always based on condition, that answer based on a past story. Yeah. And our brains, as you know, we don't really, in DBT, we don't, unless there's a skill called check the fact, we don't really challenge a thought. We allow thoughts to be present. You know, we allow emotions to be present, but just making sure your intentions are clear. Yeah, the intentions. Yeah, and those classic wise mind kind of questions of, is what I'm going to say, do or think, going to get me close or distant to my goal? Is what I'm going to say, do or think, get me close or distant to the person or group? Is what I'm going to do or say or think going to create more or less suffering? Yeah. Is it going to make me have a clear consciousness when I put my head on my pillow and it's clear? Yeah. What's going to make me feel less guilt, less shame? Yeah.
Yeah. So you're kind of giving, it is a very, very much goes with the ADHD coaching approach as well, that in what Alex was saying about very much trusting his knowings. ADHD is they know what to do, they don't do what they know. And it's that same kind of honoring the ADHD that they do know, isn't it? And so and not telling them what
Correct.
to do or assuming it all comes from them.
Correct.
They're going to
Sorry, yeah, go ahead.
Yeah, no, please.
And it's about just really cultivating that healthy self-doubt. Yeah, so it's about cultivating healthy self-doubt. But you're right, I may not know, and I'm willing to make a mistake, but to learn. Yeah, to learn that actually what I know is I don't want to be where I am. So that's a good sign. So if I'm stuck, frustrated, but you know, in a life transition now, that's cool. So at least you know what you don't want. So now it's only this way, which is forward. Yeah, which is fantastic.
Yeah, it's again, ADHDs, struggle to get perspective. They don't take context into account. That's what we see in coaching as well. And through kind of getting them to build that picture, to see the actual picture. Otherwise they're flying blind, and that's when all the troubles start and continue, isn't it? Oh, well, it's an absolute pleasure to have you on board. Really excited to be able to offer your expertise, your knowledge, experience, the skill set to our ADHDers. It's going to make massively, massive transformational impact. Very excited.
No, I'm so excited too, because I really, obviously as a psychologist trained in something, but obviously I aligned myself to DBT because it just really fit for me after all these years of doing it. And it really is nice to move away from pathology and move towards just like you as an individual who has a story that you need to share, talk about, but create a new narrative. And I like how it's not just disorder specific. It's actually just about, you are a human who needs to navigate through life. Now, how are you going to just like do it in a way that's skillful? So literally skillfully managing your life, which in itself is part of a skill we need to learn.
Yeah, completely. Yeah. And insight in mind, when these things are out of sight, us ADHDers, we just don't focus on them and nothing changes. So again, so excited. So thank you, Vic and Alex. And if anyone wants any more information, do have a look at our website. I'm not sure, Vic, you're, I think being able to book with you at the moment, I'm not sure if that's up on the website, but hopefully soon. And with Alex as well for ADHD coaching. Yes, and we'll probably be doing a webinar on DBT a little bit later, hopefully, Vic. So any questions you need, do give us a call. But otherwise, we really look forward to helping you guys tell new stories, both through ADHD coaching and DBT. Yeah. Thanks, guys. See you later.
Thank you.